Hi everyone. So for the Mondayest Tuesday that ever happened, we do not have video today. We're not going live on satellite, but this is being recorded for CBC and will be on the radio. And to those of you listening on community radio, welcome. Sorry for the delay. I want to remind everybody that scheduled updates on the weekly basis are on hold with the upcoming standing committee in session. We will have televised updates as and when needed should the COVID situation change in Nunavut for the next little while. Weekly updates will continue to be posted online on the GN website. With that, Premier will speak very quickly as an opening. Dr. Patterson will have an update, and then we can just get right into questions. Thanks again for your patience.
Nunavut miu blacko chapahe mana motikid liwutan nuban na yo 19 Nunavut iluaning ito holi tan kuwenak to ama mana motikid liwut 2,465 inuit khawyak to himayut nuban na yo 19 kangi mangata ama 400 huli utakayabut anangi mangata tan September ngutid liwo tan ukio nutango ya mele to ta ko lid na re manele lutit takwa pekko harilaw tabu takwa atu Iqaluit ama inu ila pekko hibo inu hibo adjiu ngitu au da lawsni adjiu ka hiuna lang takwa nutakkat ilinnya kalu malang mata ama kalima law mata na social media kut dan qaratawyak kut amata na kalima sugutana ikpinalaw to tana nubat na 19 ilidna we iluani iyakhimang ito nunali iluani ngipat ilidna iluani lang itok taw takwan tana nunali nubat na 19 kang ngipat takwa ilidna to ama ilidna we iluani taw nubat na 19 kang ngitok amata na ilidna na pigalit tilugo ilangi ukwa rani lert ila ilangi ilidna lertu ma ilangi ilidna rana ki ani tamam milukta ilidna leqotut tana kanon ilidna be halumati chara logo takwa government ko ila ilidna tilri kut ama takwa ilidna tilri katima yingit ama takwa angayqa tamapta pilere khatigi charluga takwa ilidna charna mata takwa ilidna tutibut nutakkat tana kanigi luang ini mi agabo mi chata luwita ko atudukta luwita pinyapta pilere khatigi chaluta amata ko uapti ni menere luta amata ko pakanna bo ilabo menere chata luwit amata ko katibbi hoktu qawi hat chata luwit ta to ungahi luta mi chaluta takwa lukta kamigit sa optigota na nugun na 19 tamaw nga lang imat wala tamaw nga napat ay tuloy lang inapta nunumiyot ublako chapakhe. Good morning. There is still no confirmed or probable case of COVID-19 in Nunavut. I'm always glad to say that. The total number of persons followed to date is 2,465. There are 400 persons still currently being followed. It's September, which for a lot of us feels like an entirely new year. It's an opportunity to restart our routine and schedules and refresh some good habits. I read something earlier on social media that really struck with me. It said, COVID isn't hiding in the halls of our school. If it isn't already in the community, there is zero chance of it getting into our schools. And this has really stuck with me. Because as we head into 2020-2021 school year at stage 1, it really isn't up to just teachers, students, and DEAs to keep our schools safe. It's up to every single one of us. It's up to the community. It's up to all of us to keep us safe. So let's all work together. Let's use our collective responsibility to keep one another safe in our schools, in our public spaces, in our homes, and that's for each and every day. Thank you, Nunavut Miu.
Thank you. Good morning. This past weekend marked the end of the 14-day period for the 23 people identified as contacts of a positive case of COVID-19 at the Ottawa Residence Inn. With the 2-week period concluded, there is no longer a concern that those individuals have contracted the virus. These past weeks, we have continued to improve our capacity for in-territory testing. The BioFire device in Iqaluit is now operating alongside the Gene Expert machine. Aside from the need to have increased testing capacity in territory, we also need to improve the turnaround time for test results. This week, the Department of Health is starting a pilot project using chartered aircraft to transport COVID-19 samples from Baffin communities to Iqaluit. The goal is to have a system in place that will reduce the test result turnaround time to 5 days or less. And once this system is in place and working, we will begin the same process in Rankin Inlet.
Ulakut, tāna la pinaswaro se mako anigonga te te kwa arwa me 23 nguyu inuit kawisakta oloktuit Nunavut 19 takalau makna yaktami arwa me tuyong mivingani residents in me tāna mako pinaswaro se anigonga tāna siama titisi mangimma kinatuin namu takunungat inunnu ismalu nang itu takwata mana amalu mana pinaswaro se kailau tatini makone kanuktu timi utuka kane simagata kano kawisang na mi kawisaw tini utuka simagata mana tana kawisaw tiyo BioFire device nguna kaktaw yu tamani kalum nilangan ama tana ay pa Gene Expert kawisaw tiyo miyutaw tema takwa makoluti katingaluti kawisaw tigi katakatigo takwa ngila kawisa katar neriyavu Nunavut unut turangang usutu takwa ngila sukar nirsaw yumi kawisaw tini nalakangin ni utekata sakayin nirsaw ngusumata takununga manayla utura niusakan ni kayo nang mayugot kangata su ku akilitok si mayugot kawisaw tini Nunavut ni kawisak tayo katak si mayunok Nunavut 19 mon tapan ini Nunavut tani kikirtalo ni tanay la kanwengi kuni kawisaw ti takwa kanwengi ti ako ti ului talimani ubaluni ila talimay ului nalaw ti nagitakwa nalakangi uti kawisak taw katak tamini uti kata unak siyuit tapong ano na Iqaluit no takwa ngila kanwengi ti akata kawisaw ti kawisaw kumamiyugutay mataw kangaksinang mi.
Increased in-territory testing capacity combined with shorter turnaround time for results will give us more flexibility with public health measures and improve our response in case of an outbreak. However, testing is not enough. As most people know, the public health strategy for minimizing the risks of COVID-19 entering and spreading in the territory rely on several measures. And testing is just one component. Distancing, good hand hygiene like washing hands, staying home when sick, and the isolation hubs work in tandem with testing and should not be underestimated.
Takwa ngila kawisa katam ni Nunavut mi takwa kawisa uti ngila nailigya si makatakugat tigwila ila nailigya ko na galwa sukan nek sa uti takwa kawisa uti tapane kalunni kawisa uti okumay ni na bikunni siya matititele manek tana atu takallaring usumatabani kawima kuyivugut ammalu tana okumay ni nerbi kunni okumay ni nerbi tinni Nunavut 19 siamati titele manek maligaleari si mayabu at jiging ala tatatak si mayo amisukalaw mata tan kawisang na pinapangulo ni kanigingin na wasakatatyan na agane wasakatatyan na ang ikasi makata na kanima yukam na kuni amma anitele ma titiko yinakto ni takwangila kayo si makata ko yigalwatago.
We should also keep in mind that our public health measures are effective only because Nunavut individually and collectively follow them. We have been effective so far in reducing the risks because each and every one of us made the conscious choice to adopt and include these measures in our daily life. Every time we choose to ignore these measures, the risk increases. While the risk can never be zero, we know that these measures are working. Nunavut remains COVID-free. We have seen decreases in respiratory illnesses this year across the territory. It is therefore vital that individually and collectively we continue to make the choice to follow these public health measures and recommendations and remain active participants in protecting our families and communities. Thank you.
Tanay isumagay giakan ko yakalawak po kumain niya bimi la kumain niya bikutigot takwa Nunavut no malitaw kanigya la kusi magalawat po kisani siya matititele manek tana pimagayo tikatiko katudya katigiti aluta tanay la Nunavut 19 isumalo na viutima tana maligaleari si mayavu malitaw tearuti katut yakatigiti aluta siya matititele maname tana siya gayang imanuna bumin ila tana ila maligayang ila malitaw kunat luakalup pangimata ila nikun kisyane katutya katigiti aluta Nunavut 19 tapung ano na bumutiki diyang ito tako si mayugo ila tay kwa kanima katatuit anasatu na me kanima ila anasatu katatuit kanima katatuit tapani Nunavut me tako ang ila ismalo tigilugi siya matititele maname tako ang ila katutya katigiluta tana ilagiluta nunalin ni miutaw luta ko katutya katigilugi siya matititele maname atuta luta kaya namin.
Question, Sharma, Nunavut News. Dr. Patterson, the 5 days or less turnaround gold time, is that for the entire Baffin region or for the whole territory?
Oh, what was the question, sorry?
So the question is the turnaround time
Yeah.
that Dr. Patterson mentioned, 5 days or less, is that for Baffin region or does that apply for the whole territory?
Tako ang ila uloy tana o kausa kauye Dr. Patterson uloy talimay tekwa kawisak taw jutigi yui ila kawisaw timo kawisak taw kataktuit tabunga kikitalo mo tuanga ba o baluni no na bumilimano.
Right now, for the next 2 weeks, it'll apply only to Baffin region communities that are part of the pilot project. Once we've got it working well and all the kinks worked out, it'll expand across the territory.
Intane mana tana kawisa ila kawisa ti utuak tu kawisa ti gijabo tabane kikitalo mitwa mana kanwengi kuti nuna bumilimamo tuanga kayakto.
This pilot project, how much time is being given to complete it?
Tako ngila tana utuau tigi yoyo tako akawi sa tinun kanutigi simayukaka utra nerinertasinni.
We're starting with 2 weeks. If we find problems, we'll take longer.
Mana pinaswarasinni makuno torangayo kisiani aula yukatiangi kuni akuni unaksawayamayo.
Do you have any idea when the machine, the biofire machine in Rankin Inlet, when it will be operational?
Kawi mabikanga tena kawi sauti biofire nguna kaktaw ya kawi sauti kanga sinang mo kayang mga.
Right now, we're estimating sometime next week.
Mana isma giyabo pinaswa ko sa kanekta din.
And my last question, so once the 2 machines are running, the biofire machines in Iqaluit and Rankin Inlet, and the turnaround time is achieved, will there be any uplifting or easing of border restrictions?
Tako ngila aula kawi sauti tamaki kayu sitian na uti tabani Iqaluni amma kangisinami takwa kanoingi kuti tekwa kawi sauti ngila kanoingi kuti kangatakatam takwa nunavumi ila nunavumu utakaswan nami takwa kano people ila ikayon nasaw kaya kata nunavumu tekwa aula ila the isolation the tekwa ngila utakakatatwe tuyo mevimin.
We're looking at that. This is when we were talking back in the spring, early summer, we had said there were 4 possible reasons to alter the measures, and if once this is in place and working, then we've got one of those criteria. So then we look at other ways to maintain some form of isolation. Yes, but we don't know all the details, and there needs to be a bunch of other things happening in order to get there. So.
In takwa ngila tana kiutu tiki janga in takwa aula katatu ngila utake katatu te kano nunavumu te reanga mana nalo naktu kisiani kawisa katatea katangusukata taiko sita mauluti ngila mana maligalere si mayavu atuarte area kangata sule kisiani nalo naktu mana katu yakatigi luta kayo sigaswa katangusukalo tugo kanoktu rasu kanang lutalo.
Important thing is there will always be, maybe not always, but there will be for now, even after this, a requirement for isolation of some sort, whether it's in the south or at home. That's not going away anytime in the near future.
Kisiani tako angila tuyo mevimi titaw kataktu nunavumu tikilaungi tilugi tana maligalea resi mayavo atuenao kenangusutumana mana ko nalo nakto kanu tigite mailingane mga kisiani tako maligalea resi mayavo ane tele makatane amma tuyo mevimi kataktu tako sule kayo si matiango suto.
Okay, thank you.
Kaya na make.
Mathieu Servet, Radio Canada. Can you give us some clarification on what is the team made of for the pilot project and what's the funding allocated for the project?
Tako ngila okaw sa kakawiti utukakta ngusummatay la nunalin ni tapani kikirtalum me kano tana awla taw ngusupa amma naki kinaw yang me takwa atung ngusupa.
There's a logistics company that's been contracted to help track and expedite samples, and they'll be routing testing samples either through scheduled flights or arranging the chartered plane to go pick them up. And there's a company that's got or will have a plane on standby to go to communities and pick up results from the health centers. And in communities, there's been arrangements for people to go to the health center and pick up samples and ship them, take them to the airport and drop them off for the airplane. So it's a group of different companies and contractors working together to make this happen. And I don't know the funds that are involved, but we can find out later.
Mamena. Takwa ngila kawi sauti utuatabut ngila takwa kangatasu me atok tuta nunalini aisa katangusutui kangatasu ko takun nga kawi sauti mo Iqaluit tikilaungin ngani takwa katut katigi tuta takwa tana pivalleruna tisimayavu kisiani takwa ngila nalunang ila kawi man kawi mangitunga nakinga mga tekwa kinoye kadu jakatigi tutaila tana pigunasi guna ila ange katigi tutatana pigunasi lelaungan.
Thank you. So the territory is now using two different machines, two different technologies, GeneXpert and BioFire. Is there one more ideal than the other for the territory?
Takwa ngila kawi sauti mako ngulanga tanuna vumi BioFire ngunakatoy amma GeneXpert. Takwa kawi sauti umata tamane Iqaluit mako luti pingayon ni isumavisimana.
Right now, the BioFire is the better option. If I could only use one machine, I'd go with that one because the supply is better and because it does an entire panel of respiratory infections. So when it's checking for COVID, it's checking for 13 or 14 other viruses or bacteria that may cause similar symptoms.
Takwa tana BioFire ngunakatoy kawi sauti mana atunak sarigaya taramana takununga kawisa katangata adjiging ituni 14 nguluti kanimana ila kanimayokan neroni takuninga 14 nguluti kawisa katami mataute na kawisa uti BioFire ngunakatayo tana actualo pima ila
just by curiosity, how many ventilators do you have at the moment? Have you decided have you think of do you want to increase the ventilators you have in the territory?
Takwangila ana satu te nunavumi katini ana satu te takakatamane.
There's 12 in the territory right now. Not counting the ones that the Medevac company has, so we're in good shape.
Man 12 nguyui tabane nunavum mi katitugi amma takwa tuaga natulagi ko nammini pekami matataw man ay sumalo tiging itabutamana.
Last question. Are you still considering the option to open an isolation hub in Iqaluit? Are there any other isolation hubs, travel bubble, that you're currently thinking of?
Manilatan kalunani portaw si makatangata tuyo me menuna bumoy silaw ngitiloge tabanile kaluni teme tumi tuyo me
No, when we were thinking about opening a hub here in Iqaluit, it was because we thought we wouldn't be able to open one in Winnipeg in time to meet the increased demand that was going on at that time. Right now, there's no need to increase our hub capacity.
Manako aga Iqaluit tabane ismaging itapo kisane ismalo tikilaw katigute ko Winnipeg me inugi alo waktu utak kayo tuyo me tuyo me mo ga kalau tu te kuninga 14 days te kani tuyo me ga kalau tu ni inu ga lo lela ngata te ma tamanna Iqaluit ismagi tu na lauta butana.
And what about the upcoming travel bubbles?
Nothing definite right now. We're still looking at it, but we put pause on any further bubbles until the end of last week when we cleared the 14 days from the exposure in the hub.
Tēnā pekotiga katātanga asin ni Nunavut mo kasutuni te kunanga tuanga yuno apere katātanga luta kiugilu ni te kua pinaswaro sige lauta tini tako te kua 23 panuingi mata ismalu tikingi tapu.
Beth Brown, CBC. Which communities will you be doing the pilot in? Is it all of the Baffin communities, or will there be a sample of communities?
Te kua ngila uturangu sutasi te kua kawi sauti nuna ila kikirtalo me nuna lili matia katu kikirtalo me atangingo supakus ubalon ne kis katina ne mana uturangu supisi.
It's all communities in the Baffin region.
Kikirtalo le mamo tana turangu sutu.
Once the pilot is finished and you have the biofire set up and working, will you still require tests to be re-verified in the south by other labs, or will you be able to only check them in the north?
Ta kua kawi sauti ngila tabani mako Iqaluit ni kawi sautau kani rea kakata yaka aulakti lugi Iqalunano.
In order to completely stop sending samples to the south, they have to be validated with, I think it's at least 15 positive results. So we either wait until we get those, or we are looking into the possibility of shipping known samples from the south that are known to be positive and then doing some extra work to verify there. But with that said, if it's presumptive positive on our machines, we are going to act on that.
I tā kua kawi sauti Nunavut 19 mo turanga yue pitaka tukakala na kakawi sauti ki yatinu aulati kataka yatu kalunano kisiane katu di katigi kat aiba ila katu jakatigi katango sutugo kalunane manilo.
I just want to clarify what you just said because it's interesting. You're thinking of bringing positive COVID samples to the north so that we can verify our machines to have them make it so you don't have to send samples south?
Yep.
Te kua ngila Nunavut 19 mo kawi sauti ila Nunavut 19 katuni kalunani maunga aulatiti luta kawi sauti no kawi tabani la kawi sauti ni teko na kawi sa taulute tana pilaringo supa anga giluni tana luta.
We've heard you speaking about cartridges for the different machines, different types of cartridges. Is there any fear of a shortage of cartridges?
Teko angila ilangi ila kawi sauti aula nariyangi amigarsi yokaka kawi sauti ila tangini.
It's much less of a concern with the biofire cartridges than it is with the Gene Expert cartridges. The manufacturer thinks they can supply us with everything that we need, and if there's a problem, we still have the we still have the Gene Expert as backup.
Ini tak kuangla tana biofire kawi sauti nakatayo mana teko aisumalo tigingina tigo tikisari watabo amigarsi jangi matago teko nanga takunanga sanayaw si mayuno tana pikunne likala nerone ay pangatana gene expert nguna kaktayo atwin na tiang usumataw isumalo tingin itavumana takwa makoluti kawisauti.
Who will you be testing for the pilot, and will those samples be included in the count that we've been given of numbers of people tested or under investigation?
What's the question? Sorry.
Who will you be testing for the pilot project, and will the numbers of the people tested for the pilot be included in our overall count of people investigated for COVID?
Tako ngila kawisauti no tan na kawisauti mo utuangu sutatino takwa kinakungu sopa ama tako nga kawisauti watuno ukausari watatino tako nga Nunavut miulimano atatitangu sopa.
So this will be for any COVID testing in the Baffin region for the next 2 weeks. So if somebody's getting swabbed in any community, it'll be tracked through this process with the goal of having it into the lab within 3 days of the time of collection.
Takwa tabanila pinaswakasari maginiata tinite kwa kawisakto si mayo Nunavut 19 mo tana atangusutu tekuna kawisauti uyamo kawisaktauluni.
And of course it's Nunavut, so everything is weather permitting.
Amma Nunavut miutawata sila kanutuin sila pijutukin lugo ilangi nokakatangata kanuingi kuni sila kayusi tiakatangusutu.
The timeline that we're looking at here for the change in the biofire that may lead, as you say, to a change in border restrictions or isolation restrictions might be looking into the fall or perhaps into Christmas time when people start traveling. Are you expecting an uptick in the amount of people who are applying to use the isolation hubs over the holidays, and are you preparing for that?
Aula katatu no pijutigil lugutakwa kano kanga isumavisi takwa tuyo me me katatu ni tuyo me katatu no pinaksaulu ni tana kanga kiangai isuma kanga kiangai isuma ko yupisi kanga tana nokati tawa yang mga taki kanutigiu gayaka kuya subimiloni takwalone aula katako mayo takwa isumagisi visiu.
We assume that there will be times, as there always is, with or without isolation requirements, there's times where there's more travel than others, and Christmas is an obvious one. So yeah, we're expecting that there will be increased travelers come mid to late December.
Tanela nereunartu kuya subimila aula katanakso gayusungu matakina kuliman itana isumagi kaningu sutavu tekane kuya subi ulungini aula katanakso ngusum matatakwa tuyo me katangu sutwe panasima palea raudungu sutavu.
I have a question for George Hickes.
Apekutayo Minister George Hickes mo.
Our indeterminate nurses haven't been able to take holidays, and our union president is saying that some of them have been threatening to quit. Are we looking at this, or is the government doing anything to address this for the nurses?
Takwangla anya siokti amigas sa katangata Nunavut miuni takwa isumagisi fisio kanu ilangila nokakoma katarsimalangata amigas silo tutigi jangano anya siokti ni tabani Nunavut mi tana isumagayaw simaba.
Thanks for the question, Beth. And one of the challenges that we want to stay away from is job-specific or career-specific decisions. Our Department of Human Resources has worked very closely with the Chief Public Health Officer to make sure that we make our decisions based on the best public health measures possible.
Takwangla iqanaya mini nammine tana pimmariyumma kisiani takwa anna siortigi yavut uqaqati ila iqanaya tulqiyikuningaartuit tana Luther Patterson alla bingani uqaqatigi tiaqattartugut kisiani takwa maligalearisi mayavut iqanaya tulqiyikuningaartuni atuartiartugit tana sulikayusi simangusuttavu.
Yes, sorry, Megan. That being said, we have a lot of public servants who are able to work from home, who did work from home in March, and then we have a lot of public servants who can't work from home because they're essential workers or frontline workers, our CMP, our corrections workers, our healthcare staff. It's inevitable that there will be employee burnout when we have high need in our healthcare environment. Is there not anything that is being considered to ensure that our nurses are not burnt out when COVID does come here, if we assume that that's going to happen?
Takwangla kinakulima Nunavut me angekame iqanaya qatalawngata amma tekwa ilangi angekame ungitu iqanaya qatalawngata ta nanuwatuana 19 pigiani reilautangani takwa anasiortivut ila takwa tuavanatolari yikune iqanaya qattartuit anasiortit palisi kina takunanga pimmario yune iqanaya qattuni takwa taqaluarti tauni angimata tana panga tausimava qanortuuqu tausimava takwa iqanayarti pimmario yume iqanayalit.
Thanks again for that follow-up question, Beth. I think it's very important to recognize that the challenges that, especially healthcare staff, but you look across all the professions that you just listed as critical and essential workers, it is challenging. We acknowledge that. I know I personally can't thank the people enough that are going to work every day. It's stressful and it's exhausting. I hope that anyone who is going through any challenges at work does reach out and talk to people to gain whatever supports are available. I can assure everyone who's out there watching and listening right now that this government is very supportive of our public service, and we're going to do whatever we can to keep them safe and continue to keep operational requirements in place. We're doing everything we can. Thank you.
Palisi kutakwa taubunga limangila iqanaya qattangata taqattia tuti qautama tia opaina tuti takwangila nammine taqasugi guti isumakuluni naukulu tuina tia takwa gavamakutini isumaligiyikut ikayurti takwa uqaqati qumanneruti kina tuinattiammu ila kina tuinattiammu taana tuqaangayu takwa ikayurti qanu tuinattia atuinnauttiangata quyali simattiartunga ila takwa tuavannartuleriyikuningaatui takwa aanniasiorti kinakulima takwa pimmariyuyumi iqqanayaaqartui quyali simattiartunga assuruinnartiartu tatakwa taana nuvartuana 19 pijutigillugu taqananga quyalittiartunga iqqanayainna tiaqattaqatta taakunanga pijutiqartuni.
Megan Dooling, Nunatsiaq News.
On July 31st, it was posted in the Nunavut Gazette that there were 2 special warrants taken out, one for $10.6 million and one for $500,000 for health. What were those for?
Tema takwa kino ye okatau se malaungata amisui. What were the amounts again? Sorry.
10 million and 500,000.
10 million, amma 500,000 nguluti takwa tuqaarti taulaungata aaneaqanginartuleri yikunu taana kisumo lauqa.
And the 10 million was a roundabout number, but I guess in a nutshell, Megan, the 500,000 was to provide the additional contracting support through the Iqaluit Corporation, who we've contracted to help manage the hubs. There's some increased costs from the estimates from, I would say the best battle plan only survives till the first contact, and so we realized that there was going to be some additional resources needed, and the 10+ million was for lengthening the time for the isolation hubs, because we didn't know how long we were going to have those measures in place, so we needed the money to continue with the contract.
Takongila tuyo maybe tita watwe Nunavut mo isilaw ningen ni tekwa aki atuasima lautwe akingin nu tekununga turanga yote na 500,000 amma tana unga bagak tau jutiki yang tau tana turanga me yutau tena. How much? The other amount?
10+ million.
10 million.
The federal government announced $2 billion for school support. What is Nunavut's share of that, and how is it being spent?
Tanela kanat lima me 2 billion. Nguna katau yut ilinervin nu turanga ngusuman Nunavut me no kanu ala katimi Nunavut mo turanga ngusupan.
Thanks for the question, Megan. I believe it was around $5.8 million that Nunavut will be receiving through that to help enhance cleaning, potential for overtime for custodial staff in the school, also to make sure that there's PPE available if needed.
Amatakwa 5.8 million tana Nunavut mo turanga ngusutu takwangila iliner binu salumatia kataria kangata ama atwina hotel luti kisulima atoktaw ya khayartu salumatitao ya khannertu me iliner binu.
I think my next questions are for Dr. Patterson, please.
Dr. Patterson mo turanga yo.
Dr. Patterson, I'm sorry, I think I missed it. I just need some clarity over the announcement that you made today. The pilot project is to charter potential tests from other communities to Iqaluit to be tested, or to Southern labs to be tested?
Tana nalunay kanarunakyo nalaya ila ukausari kanarunakyo teko akawisaw tiyo yui nunalini ngatui tabunga ekalunungu supa o baluni aulot taw katangu supa kalunano.
It's to bring the samples here to Iqaluit for testing, because the biofires without this, they really only are all that useful for residents of Iqaluit.
Ita tabunga ekalunno aulot taw katanga musutui.
And what is the logistics company that you've hired to do this?
Amma teko kinakuvat teko
Can I say that?
Kangatasu Larico Kinakuva.
It's public. Yeah. BBE is I don't know their full name though, but that's the letters we've been calling them by, BBE Logistics. They're a northern company. They've done the same sort of work with, oddly enough, with the mines, where they expedite the shipping of their samples and seem to be effective. And I'm sorry, I jumped the translator. Apologies for that.
Itakwa kawisauti ngila ila Tēnā ila takwa BBE nguna kakau yu naluna si matiang ina tigu suna mga tatana ila atungu sutavo kangatara yu lega yikuninga tu itakwa Uyakane atulaga yikuninga tu ni ekanaya kati kakatan ni kumata takwa atokatangu sutavo utu tigilungin.
Sorry, and what airline will be doing the charter flights?
Chinakongo supateko kangata sulaga yi.
That I can't remember, sorry. The contract went through procurement with CGS. It went out for tender and the usual process, but I can't remember the name of the airline.
Manago ikamangitanganalya kangata sulaga yiko atungo sumanga.
And apart from, if this goes well, apart from potentially easing border restrictions, you said other public health measures may be loosened or changed. Can you elaborate on what that might look like?
Tako ang la sa dipalya katango sumata malagalaya kay simayabu kano to simalakisi kano ilingalakan taman na.
We'd continue moving along on Nunavut's path, and that some of the next steps would be some of the high-risk things that we haven't touched at all since we started reopening, and some would be increasing the limits of inside gatherings and some physical activity measures that are still limited in size or capacity.
Tako ngila matwera palya katalangata nunavulima mekisulima katima ila katigin tako kisani mana sulitana tuave ila tua ismalu tigilwang itavu tuave ismalu tigilwang nagu tako katima katigin is it 50?
It's at 50 right now, 50 or 50%.
50 mi matamana katinga gunna tu kanigi tele mane tako amma wasa katatane atu takwa maligalea risima yebo katuti ila katima teliman takwa 50 titavumana.
Thank you. Anyone else? Can I ask one more question? Sure. For Mr. Hickes, please.
Minister Hickes mutana pekote.
Mr. Hickes, where are we at with subsidizing airlines? Have you given them more money? Where are we at with talks or with the federal government?
Man tako ngila o kausare kun nakiki namele mangata federal government ila government ka kuninga tu ama government kuninga tu ni man nakano ilinga lekita.
Thanks for the question, Megan. And I don't have an update. I can't tell you to what we've progressed to this point. We are dealing with the two main airlines that provide transportation, both passenger and cargo around the territory. We're back and forth with financials. As people are traveling more within the territory, it's impacting the financing need. So we're making sure we're doing our due diligence, and we are working with airlines. There's no clash or anything right now. We're just continuing to make sure these are public dollars that we're using. We want to make sure we do it right.
Tako ngila aula katatunu ila tako Nunavut ta namatwe tau simalaunga Nunavut namutwe na aula katakunang ne te mangani aula katatu Inuit amma sunakutane aula kotau batui tau te kwa nale ano katui nakatangu sumata te ma takwa katu jakatigi simatyatavut tamanna.
Beth Brown, CBC. I wanted to just follow again on the nurses. You had said that, and fairly enough, that we're trying to treat our public servants all the same right now and hold everyone to the same standards. But I'm wondering why, during a global pandemic or health pandemic, you would want to treat nurses and healthcare workers along the same standard as someone who's working at a desk.
Takuang la pekutigi yaka toranga yu okausare kauye ane sirtinu makununga tuavana tolari kuno summanga ila summa pimario nersau titi simavi pinmario titi simavi si takununga adjiging itangini pisima mangasi kina ila isu maging waktu ko takwa tuwa na tulagay ko ama asyane kanayati kanaya bingani sami kanaya sumi.
Thanks for the question again, Beth. And I'm not sure what I could add to my earlier response. We are working very diligently with our Department of Human Resources, or Department of Human Resources working very diligently with our Chief Public Health Office to make sure at the end of the day our first and foremost responsibility is the safety of our workers. And I do realize that there are certain positions within the public service that are more complicated to be without for an extended period of time, and that's why we've had to take the measure of putting in the restrictions across the board. Anyone can apply for exemptions. We've done it for compassionate reasons or for other employment reasons, but at the same time we have to, our first and foremost priority is the safety of our civil service and our population.
Apekutoy mo itana pimario nersau yuingila ta ko tuwa na tolai kuninga tuwekna yati kanuingi yutigi yangin no kisiani tana isumalu tigi gatigo kisiani kinatuina tiata na turanga yugalo uto tata tiluti utokonna tuikina tuina tia kisiani takwangila tuavana tulari kun pimario mata takalo aleroti kinako atuina gera la mata takunanga Nunavut miuno kisiani kinatuina tia mutana ikayone riyavo turanga yo uturluti ama ikayo khatasima me yugo kina tuina tia ekanayati takwa angirta uluti tuavana toka to ila namine ilangini tuavana toka naone makwa kanugolo ye kisutuina ngila ekanaya ni nukarakas tukasungu matautakwa kina tuina tiamo turanga yo kisiani tuavana tolari kutakwa turanga nersau sima sugiyabu.
Thanks everyone.